All right, let's wrap up with diuretics. Now, these are covered in more detail in our full lecture and cheat sheet on diuretics, but for the purposes of blood pressure, this is what you need to know. Now, diuretics work by removing excess sodium and water from the vascular system, which reduces blood volume, which reduces cardiac output, and therefore blood pressure is going to go down. Now, there is two main types of diuretics. First is our potassium-wasting diuretics like hydrochlorothiazide and furosemide, and then we have our potassium-sparing diuretics like spironolactone. So because we're getting rid of water, sodium, and we're altering potassium levels, we need to be on the lookout for a few things. And the first is electrolyte disturbances. So for our potassium-wasting diuretics, we need to be on the lookout for signs of hypokalemia, or potassium that's too low. So we need to be on the lookout for muscle cramps, weakness, and irregular heartbeats. For our potassium-sparing diuretics like spironolactone, we have an increased risk for hyperkalemia, or potassium that's too high. So we want to teach our clients to avoid any potassium supplements or any salt substitutes, which also contain a lot of potassium. The second thing we need to be on the lookout for is dehydration, which makes a lot of sense because we're giving a medication that's causing a lot of water loss. So we need to look out for signs that our client is getting too dry. So low urine output, confusion, or rapid weight loss are all red flags. And lastly, we're going to see increased urination. These drugs get rid of excess water, so increased urination is an expected finding. But this also means that timing of administration is really important, because if we give a medication that causes increased urination right before bed, what do you think is going to happen? Well, that client is going to be up all night having to urinate, which is going to cause sleep disturbances and potentially a fall risk. So we always want to give diuretics in the morning so that we're not disrupting sleep. All right, it's time for our last NCLEX quick check. Clients taking calcium channel blockers should avoid consuming what? Remember, that's going to be our grapefruit juice because it inhibits the metabolism of these medications, which can cause toxicity. And lastly, what time of day should diuretics be administered? Well, remember, we said we're going to give those in the morning because if we give them at night, the client's going to have to urinate all through the night, which is going to disrupt sleep and potentially create a fall risk.